Good evening. Uh, how are you today?
Hello, I'm good. Actually, I'm here to collect my sleeping tablets.
Okay. Can I ask your name, please?
Yes, my name is Maria.
Okay, Miss Maria. My name is Zara Satar and I am the pharmacist today. Okay, so you are here for the sleeping tablets. Um, can I ask you the reason? Uh, did you have any symptoms or any health conditions?
No, I just cannot sleep. That's why doctor has given me these anti sleep tablets.
Okay. And Miss Maria, can I ask that did you use before any sleeping tablets?
No, this is first time I'm going to use them.
Okay. And the sleeping tablets actually you have to take it before bedtime. For example, half an hour from your bedtime, and you can't do not take it routinely, and just when you like just take it as required. When you feel you can't sleep, then you can take the tablet. So avoid using routinely. Is that okay for you?
Yes, thank you.
Okay, Miss Maria, so do you know about the side effects of sleeping tablets?
No, I would like to know. Can you please explain?
Yes, Miss Maria, as there is some side effects as well of the sleeping tablets, you can feel dizziness and headaches or any memory or performance problems. So you can feel also drowsiness as well. Um, these are some side effects you can might be have. So do you have any more questions?
Yes, actually, I would like to ask you: are these sleeping tablets antidepressants?
Yes, Miss Maria. These are uh, for the insomnia patients. We can use antidepressants in lower doses for the patients who can't sleep. So it is antidepressants also be used as a sleeping tablets because it contains sedative ingredients which make you sedative and increase your drowsiness, so it can treat your sleeping difficulty. Now you can now you understand.
Yes, but I am concerned that I'm not depressed. I just have insomnia.
Miss, as I explained, Miss Maria, if for the depression, the antidepressant tablets used in higher doses, but for the insomnia or for the sleeping difficulty, so we can use antidepressants in lower dosage. So there is a lower risk of side effects and it can use only for the short term and irregular use only, as doctor describes you today, as doctor previously described you. So now you understand that.
Um, yes, I do. Thank you for explaining.
Okay, and Miss Maria, I also recommend speak to your doctor if you have any other concerns, and if there is any more questions for me today.
No, thank you for explaining everything so far.
Okay, thank you so much, Miss Maria.
Okay, it was nicely done, but the second task was not good. Like when client said that I'm here for the sleeping tablets collection, you can say, before we proceed, I would like to ask you a few questions. Is that okay with you? Then
Mhm,
they will give their
mhm,
consent, and then you can ask them. So you can say, first of all, I would like to ask you, do you have any health condition? They can say, yes, I have
mhm,
insomnia. Then you can say, secondly,
mhm,
do you are you using any long term medications? They will say yes or no. And then you will say, lastly, I would like to ask you, have you ever used sleeping tablets before? That's how you will ask this question. First of all,
Okay.
you will like ask for their consent that we are going to ask them a few questions. Then about this
Okay.
task, like before starting this task, you can say, now I would like to explain you, or you can say, I would like to give you some information about sleeping tablets. Like you have to give a
Mm-hmm.
heading first, like what are you going to say, so patient is ready to listen.
Okay.
So then you can
Okay.
explain, just take before bedtime, only take as required, and you miss this thing, avoidance of alcohol. So it will also count as like content missing here. Then
I'm talking about the fifth task now when patient said that he is worried that he doesn't have depression and he just have insomnia. So the way you said that, like I have explained earlier, that is fine that you are explaining patient this thing that you have told him things earlier, but it would sound a bit rude. You have to reassure them first, like you have to make them feel heard, that you heard what they said. You will say, I understand that this prescription made you think that you are taking antidepressants and these are for depression, like anything you can say just to reassure them, like what are they thinking, just to make them feel that you heard their concern. And then you can reply them saying, but I would like to assure you that these medications are used for insomnia in your case. So first of all, you have to acknowledge what patient is saying so that they feel heard and they don't feel judged and they don't feel like you are not listening to their point.